All right, everyone hearing me okay? We are ready to get started. I'm super excited to have you all here. My name is Rachel Taylor. I'm our Director of Nursing Services here at Archer. Been in nursing education for 5 years now, and 4 of those have been with Archer. So I'm super excited to join you guys today to dive into the 2026 NCLEX updates. More importantly, we're going to talk about what these changes actually mean for you as someone who's going to test or how you need to educate. Because this exam, it's not just testing knowledge, it's testing whether you can think, prioritize, and make safe decisions in real world situations. So as we go through today, I want you to shift your mindset from what do I need to memorize to how do I need to critically think and apply clinical judgment. That shift alone changes how you approach the entire exam. It's going to change how you think through your studies and how you're going to apply your thought process when you get to test day. When you think about the NCLEX right now, I want you to answer in the chat. What feels most uncertain or intimidating to you? Or if you are an educator joining, what questions do you have right now? What's the thing that you're like, I feel uncertain about this? Let us know in the chat. I know I've had a lot of students reach out to me and say, Rachel, I need to test before April 1st because I'm really nervous to test after April 1st. And I'm going to put that worry kind of to rest today, but I want to see what your main concern is this moment. Priority, NGN questions, context issues, the unknown, pharmacology, being a repeat test taker and building confidence. Absolutely. Feeling uncertain about the in the next 30 to 40 minutes. Okay. Language is very vague. Absolutely. It is vague. All right. Well, we're going to keep on going. Thank you for sharing those and feel free to continue in the chat as we go. Morgan is in the chat. So if you have questions, you can put your questions in the Q&A. She will be able to answer any questions you have in Zoom. We'll also be keeping up with Facebook and YouTube to make sure we answer those too. So first of all, the unknown is scary. You guys are saying that. I can feel that at times, but I do want to anchor ourselves in what is actually happening. The new test plan, it goes into effect April 1st of 2026. Now, here's the important thing I want you to hear. This is not a complete overhaul. It's a refinement. The NCLEX, it's evolving to better match what nurses are doing right now in practice. Not what they did 10 years ago, but what they do right now. So if you've been studying using NGN questions, case studies, clinical reasoning, practicing those 6 steps of clinical judgment, you're already moving in the right direction. Who's been practicing next-gen NCLEX questions and even traditional NCLEX types? All of that is still going to be on your NCLEX. That's not changing. So this should feel really reassuring, not overwhelming, because it's not reinventing the wheel. The exam is going to pretty much look the same today as it will on April 1st. There's just a few changes coming. Now, I want to ask you guys to put in the chat, does refinement make you feel more confident, or is it still make you feel uncertain? Knowing that they're just refining the exam, they're not overhauling it. How does that make you feel? Still feeling uncertain about it, but a little less anxious. That's good. We're making steps in the right direction. For some of you, you're like, hey, this is making me a little confident. So the exam format, let's talk about what's staying the same because that matters just as much as what is changing. The exam is still going to use computer adaptive testing. That is where the test is going to adapt to you from 85 to 150 questions. That looks exactly the same. Test length is not changing. The exam will shut off when there's a 95% confidence interval that you have either passed or you have failed. I always teach my students plan for 150 questions, take a break at question 86 and 115. And if it shuts off before then, that's okay. And I want you to go in with the same mindset, even if you test after April 1st. We're still going to see those NGN case studies. You will have 3 to 5 unfolding cases, but only 3 of them will be scored. Really, the only difference with those unfolding cases is you may see some cases that look at multiple clients within one scenario instead of looking at just one client. And then the client need categories, they are unchanged. They are staying exactly the same. The percentage breakdowns are also the same. So structurally, the exam looks the same. Structurally, the exam is not changing. Here's where students sometimes get caught off guard. The depth of thinking is increasing just a little bit. They really do want you to build that clinical judgment. So you may recognize the question style. The only big changes, instead of looking at one client, you might look at multiple because they want it to be as close to real world as possible. And that's not going to be with every unfolding case study. You might just get one that looks like that. One thing I really want you to work on as you're prepping for this exam is, can you explain the why? When you go through a practice Q bank, for example, like what we have at Archer that's aligned with the 2026 exam, can you explain why an answer is correct? Can you explain why an answer is incorrect? Not just recognize it, but explain it, because that's what tells me that you are NCLEX ready. So here are the biggest updates. They are really going to be focused on wording and activity statements within the test plan. The NCSBN has clarified expectations to really reflect what nurses are actually doing in practice today. So the biggest changes, they're not flashy. They're just really intentional. So you're going to see some updated wording, refined activity statements, and a stronger emphasis on application. This exam is continuing to move away from, hey, do you know this fact? And toward, can you use this information safely in a real situation? What this means is you want to make sure that you're connecting concepts, you're able to recognize patterns, and you're able to make decisions, even though sometimes you may have incomplete or vague information, because that's real nursing. Now, I'm seeing some questions that I want to make sure we answer. Does Archer already reflect these changes? Yes, we do reflect these changes because the exam isn't changing a lot. The exam content is basically the same. What you needed to know to be a nurse last year still looks the same this year. It's just a little change in how they're wording things. We're going to look even further into that. So if you've watched the videos in Archers on demand, those concepts, that knowledge is still preparing you for the test that you will take in April. Clinical judgment, it's not just part of the NCLEX, it's truly the core of that exam. You're going to continue to see those unfolding case studies. You're going to see changes in client conditions and multiple clients where you need to prioritize. And someone asked for an example of that. So what it will be is it'll typically show client 1, here's their situation. Client 2, here's their situation. Client 3, here's their situation. Client 4, here's their situation. You'll have the data for all 4 clients, and then it will take you through the 6 steps of clinical judgment. It may ask you about all 4 clients. It may just specifically ask you about 1 or 2 of those clients, depending on the question, and it can change. And there are questions unfolding cases like that in our Q bank. Yep, there is a full unfolding case study that looks at 4 clients in our Q bank. So what is your role? It is to continuously recognize the cues, analyze what matters, and decide what to do next. This isn't just memorization. We're truly critically thinking through what we know and making those connections, because that doesn't just make you stronger for the NCLEX, it makes you a stronger new grad nurse. So when you see a long case study, I want to ask this question. What's your first instinct? You get a really, long case study. What's your instinct? Let me know in the chats. Yeah, you need a little break before you read it. Sometimes it's like, not another unfolding case study. It's so much information. What I want you to do when you get an unfolding case, and we have actually a small group tomorrow that focuses on this a little further, but I want you to look at the question first. Just take it one question at a time and then read all the content. Because what it does when you read the question first is it cues your brain of what do I need to look for? What am I skimming through? What am I making sure I take away from the case scenario? And that can help it where you're thinking with a higher priority. You're more narrow when you're actually going through that content, and it won't take quite as long. The other thing I want to ask you guys to reflect on is what step of clinical judgment do you struggle with the most? Is it recognize cues, analyze cues, prioritize the hypotheses? Is it generate solutions, take action, or evaluate the outcomes? You want to know those 6 steps, and you want to make sure that with those 6 steps, you are able to ask yourself questions to help you get to that right answer. It looks like for some of you, it might be take action. The partial credit looks the same. The scoring looks the exact same as it did for the NCLEX since the last update in 2023. Scoring for the exam is not changing. Difficulty level is not changing, okay? So let's clarify. This is the part that's changing, guys. What is listed on this slide right now, these are the changes, okay? These updates, they're not introducing brand new content. They're making expectations more explicit in areas that matter. Equity, dignity, privacy, safety. These are things that you already know. You've been learning these things, but they're being more emphasized clearly in testing. Because being a safe nurse isn't just clinical, it's ethical, it's respectful, and it's being aware. So when you think about this, one of the ways that we're updating wording is instead of using the word substance abuse, the NCLEX is going to say substance misuse. You already know about substance misuse. All they're doing is changing the language. Okay, they're just changing the language just a little bit. The other big update is for HIPAA, they now specifically address social media use in the test plan. Why do you guys think we're now addressing social media use with HIPAA? When I became a nurse, I didn't learn anything with social media and HIPAA. Why do you think we're addressing it now? Because we've got nurses doing TikToks while they're doing their med pass. We've got people making TikToks in the med rooms while they're getting ready to do meds. We've got, pictures where client information might be in the background. And so they had to emphasize the importance as nurses of how we protect our clients and their confidentiality. In basic care and comfort, it gets even more into the same topic, really, is how do we ensure that our clients' dignity and privacy is maintained during care? For example, I shouldn't keep my client exposed. I should only expose the area that I need to be working on because we want them to feel comfortable when we are doing care. And then with physiological adaptation, what is it looking at here? ICP monitoring is an example. We're looking at more monitoring than we used to. But you guys already know ICP. You know the basis of this. And so you already have most of this information. It's just being more targeted in the questions over it. So really, there's no major change to the content. How you have been preparing is preparing you for the 2026 exam. There's just a greater emphasis on safe, ethical, real-world nursing practice. So let's break down these new activity statements. There's 3 that have been added to the RN exam, and I want us to look at all 3 of them, okay? This presentation, by the way, will be posted to our on-demand resources as well as YouTube. So you will be able to access it anytime you need if you're curious about the updates and want to review what we covered today. So our first new activity statement is a powerful update because it addresses common misconceptions. Equal care is not always safe care. It's about equitable care. It's not the same thing. Equal care does not mean equitable. Equitable care means that we're prioritizing based on need. We're individualizing that care. We're respecting. If a client is different than me, that's okay because I respect what they want. You're expected to consider things like culture, values, their preferences. What is their access to care? Because that's what being client-centered care actually looks like. So I want to ask you guys in your clinical, have you ever seen equal care lead to poor outcomes? I think of my own journey in the ICU. If I were to give each client They get 3 hours of my time in the shift. Okay. Let's say it's 3. They each got 3 hours. That's about 9 hours. And then, I've got 3 hours extra to do the other tasks that I have. That would be equitable care. That'd be equal care, but not equitable. And that's what we want to make sure that we change. All right. So let's do a practice question. I think you guys want to practice this. Are you able to apply? So here's a question that would potentially fit into this category. The nurse is caring for a diverse group of clients on a medical surgical unit. Which action best demonstrates the provision of unbiased and equitable care? A, allocating equal time and resources to each client regardless of differences in clinical condition. And what I like to do then is compare to B, prioritizing care based on acuity while incorporating client-specific values, needs, and preferences. Between A and B, what do you guys like better? Yeah, I like B a whole lot better. I agree with you all. So I think we're going to get rid of A because we already talked about how equal care does not mean equitable. They're two different things. C, providing standardized education and interventions to ensure all clients receive consistent care delivery. What one do you like better, B or C? I agree. I like B the best, which means we can eliminate C. Now let's go to D. Modifying the plan of care primarily based on client requests, even when they conflict with best practices. Okay. What do we like the best? You guys are spot on. We like B the best. So we're choosing B and we're moving on. And you are absolutely correct. Because equitable care, what we have to do is we have to prioritize the client needs. We have to make sure that their basic needs are always met. And that might look different between you and between the next person. Okay. All right. So let's look at our second new activity statement. Let's just all take a deep breath. I know these updates can feel a little overwhelming, but you guys have got this. You're doing awesome. Our second one is in basic care and comfort. And this update, it's going to really look about setting boundaries because let's be honest, in modern healthcare, boundaries become easier to blur, but your responsibility remains the same. We protect dignity, we maintain privacy, and we keep information within appropriate channels only. Even if you are well-intentioned about sharing something and you're like, I'm going to protect client identifiers, but you're sharing and it's not need to know, guess what? You can still cause harm. And I want you to take a moment because I think it's really important we think about this. Why do you think social media creates risk for nurses specifically? We've seen cases time and time again over the last several years of nurses misusing social media, of nurses not providing client dignity and privacy during care. So we do want to make sure that we are thinking about that. Where is the line between education and violating somebody's privacy? That's where I want you to think. So let's go ahead and let's look at our practice question. The nurse is preparing to perform a sterile dressing change for a client in a semi-private room. During the procedure, the client shares a unique clinical detail that the nurse finds interesting. They consider discussing this on social media for education purposes. The nurse should then do what? So let's go through this question, how we did before, because I want to make sure we're thinking through best practice for even just how to answer NCLEX style questions. A, document the case and later share a generalized version online without specific identifiers. Or B, ask the client to sign a release form allowing the case to be shared for educational purposes. What do you like better, A or B? Oh, you guys are like 50-50 on A versus B. All right, it looks like more people are saying you like B better. So we're going to get rid of A. It looks like B right now is the winner. Let's look at C. Limit exposure during care, maintain privacy, and document the findings in the client's chart. What do you like better now between B and C? Good. Now someone's saying, hey, I've purchased a QBank. I'm not seeing these changes. We just add them in. It's not going to like flash up like, hey, this is a new question. They're just added in as they get added, as we add more, we just put them in your Q bank automatically. So you don't need to worry about, oh my goodness, did I get the right Q bank? We just have, the one for RN, one for PN, and those updates are just going to be added in as needed. Okay. Really good. We got rid of B, we're keeping C, and now let's look at D. Present the case in a restricted professional forum using only clinical data and no personal details. Oh, now some of you are like, oh, I think it's D. No, I'm going to get rid of D. Even in a professional forum, do those people need access to this client's care? Do those people need this information? The answer is no, and because of that, C is our best answer. But do you notice how that one really got several of you, where it was like, oh, I could see me changing the answer to D, but those people, even in a professional forum, do not need my client's information, whether I took out client identifiers or not. All right. Then our third activity statement change is in physiological adaptation. So this was also added. And it was monitor and maintain internal monitoring devices, such as intracranial pressure monitors and intrauterine pressure catheters. So really what they want you to be able to do, monitor the device, recognize if there's a complication, and act early. This is not advanced nursing. This is entry-level safe practice. Can you monitor, assess there's an issue, and intervene when there is? The key skill here, it's not memorizing numbers. It's recognizing, okay, this is when there is something wrong. So I want to ask you, what's harder for you? Remembering your values or identifying the trend? Where do you find it more challenging? Yeah, identifying the trend can be really hard. Yeah, and remembering, hey, what's expected? Really what I want you to think of is what thing is urgent? What do I need to assess first? Using your prioritization toolkit that we teach at Archer, that can really help you figure out where do I need to prioritize. So here's our next question. The nurse is caring for a client with an intracranial pressure monitor following a traumatic brain injury. Which finding requires immediate nursing intervention? And don't just look for the highest number. Hint, hint, hint. All right, let's look at this together. Okay. A, ICP reading increases from 14 to 18 over 1 hour with a stable neurological status. That keyword is important. Or B, ICP waveform appears dampened and the transducer is noted to be below the level of the foramen of Monroe. What do you think between A and B? What one should we keep? Okay, you guys are like, let's keep B. C, ICP reading of 21, client reporting a mild headache and no change in level of consciousness. What one do you want to keep now? So the monitoring of the device and knowing how to intervene, if you've never been exposed to that, it may be an area to review. Muhammad, great question. Okay, it looks like you guys are like, let's keep B. D, ICP reading of 20 with new onset of confusion and unequal pupil size. D, there's clearly an issue. Despite their reading being lower than client C, they have this new onset of confusion and unequal pupil size, which tells me that we likely have really gone from early stages of increased ICP to late stages by the time we're seeing pupil size being unequal. So we want to make sure that we're addressing and assessing this very early. So you were correct if you said your correct answer is D. Now, we do want to make sure if that transducer isn't level, that we do level it. Like that should be corrected, but it's not life-threatening. It's not life-threatening if we go back to this one, if that waveform is dampened. What is life-threatening though is if they have an increase in intracranial pressure that is causing neurological changes. That is life-threatening, okay? So let's just recap. What's not changing? And this slide is really kind of grounding for me because when students hear changes, they often assume everything is different. But your foundation, it remains. your core content, the structure, the standards. You're not starting over. You're building on what you already know. Core concept areas like med-surg, psychiatric health, OB-PEDS, they're still tested. The exam length and the adaptive format, it remains the same. The passing standard, it's not changing. It's not suddenly jumping. So while updates exist, your fundamental nursing knowledge, it's still your foundation. So what study tips can I give you? Preparation now, it should be intentional. It shouldn't just be doing questions, but how can I do questions to walk away being a stronger nurse after them? It's by analyzing your thinking. Can you understand the rationales? Can you practice prioritization? You need to train your brain to think under pressure, because let's be honest, you might get test anxiety on the NCLEX, but you know what else happens as a new grad? You get anxiety. You get decision fatigue sometimes as a new grad, and you want to train your brain to know what to do when that happens. You want to be able to recognize patterns, especially if we're trending in the wrong direction, and be able to make safe decisions quickly. Now, I want you to reflect on two things. And the first is this that I want you to answer in the chat. Are you studying passively right now, or are you studying actively? And I want you to put that in the chat. Some of you are saying I'm kind of passive. Some of you are active. But if you're passive, ask yourself, how can you change that to active? Even a task like watching a video can become active. For example, Morgan, who's in the chat, she does a lot of our on-demand lectures. But instead of just sitting back, eating a snack like popcorn and listening to her, what I could do instead is pause after each core concept, and I could walk myself through what would I identify at each step of the 6 steps of critical judgment. You've now taken that passive learning opportunity and you've made it active. You've now made something where you can start to connect all of the critical thinking together to refine your clinical judgment. And that is really going to be an asset to you as you're studying. If you're going through the Q bank, go through it out loud when you're just practicing. Because when you hear it, it's going to say, hey, did this make sense? Don't explain the rationale in our words, explain it in your own words. Because again, that's how you start to bring these connections together to improve your critical thinking and your clinical judgment. And I want you to ask or reflect on this. What's one change you can make to start studying more effectively? I want you to walk away from each study session saying, I know more today than I knew yesterday. But if you're just going through the motion, you could walk away not knowing anything. I think of it like going to the gym, which I do not do enough. I'm just going to preface with that, okay? But if I go to the gym and I just kind of hang out for an hour, okay, I went to the gym. I went every day, but I just hung out. I wasn't intentional. I'm probably not going to see a lot of change. But when I start getting intentional there and I'm really putting the effort in, even if it's just the 45 minutes, guess what? I'm going to see way more change in that way. It's the same thing when you're studying for this exam. Now, if you're an educator joining us, I do want to touch on this as well. The slide is really the heart of the shift we're seeing, not just for students, but for educators. Because at its core, the 2026 NCLEX, it's about real-world alignment. And what does that mean? It means the exam isn't just students know the content. It's asking, can they use that knowledge safely in real evolving clinical situations? That's the big difference. Let's start with that clinical judgment focus. Let's teach that early on when they're first starting with us in their foundations classes. Because what students have to be able to do, they have to recognize what matters. They have to filter out what doesn't. They have to adapt as new information is introduced and decide what's a distractor and what do I need to focus on. Because in real practice, nothing is static. Our clients change, our conditions evolve, our priorities shift. So we have to ask ourselves, are we teaching students how to think or just what to remember? The NCLEX, it's placing strong emphasis on things like prioritization, safe interventions, knowing what to do first, not just what could be done. And this is where many students struggle. And if you're a student joining, I want you to hear me in this. It's not because you guys don't know the content. but it's because you haven't practiced making decisions when you're uncertain. You're never going to feel 100% on every decision you're going to make. And as educators, it is our responsibility to make sure that we're creating opportunities for you to rank priorities, for you to justify your decisions, for you to think through the consequences of your actions. We have to make sure that we're teaching you equity, dignity, and HIPAA awareness. They're not just soft topics, they're safety issues. And students, you need to understand that these decisions, they matter just as much as clinical interventions. And so when we step back and we look at all of this together, the question becomes, are we preparing students to pass the test, or are we preparing them to be a safe, confident nurse day one? And at Archer, we're doing both. That is our goal here. Because now those two things, they're directly aligned. So here's kind of the final takeaways that I hope you got as we start to wrap up. I want to leave you with something that I hope brings clarity, but I also hope it brings you some confidence. The 2026 NCLEX, it's not designed to be harder. It's designed to be more in line with what real-world nurses are doing every day. It's more reflective of what nursing actually looks like. It's making decisions with vague information where you maybe don't have every little detail you'd like. It's prioritizing competing needs and acting in ways that protect client safety. The exam, it continues to center on clinical judgment and safe care. But it's not perfection. It's not memorization, but your ability to think through a situation and choose the safest, most appropriate action. And here's something really important. These updates, they're not adding overwhelming new content. They're clarifying the expectation. You're not starting over. You're building on what you already know. Your nursing education to this point has already prepared you for this test. Every clinical day, every case study, every time you ask, what do I do first? You've been developing these skills, everyone. Trust those skills you've been developing. So what does success look like moving forward? It's not necessarily just doing more, it's doing the right things consistently. Practicing prioritization, strengthening your decision making. Focus on why, not just what, so that you understand why you're choosing the answers you do. And finally, one of the things that makes students most consistent or most successful is staying consistent. Make sure you're using updated resources that align with the 2026 test plan. Archer is one of those resources for you. And most importantly, trust your preparation in the process. This exam, it's not asking you to be perfect. It's asking you to be a safe thinking nurse. And that is exactly who you're becoming. So I want you to think about what is one strength you already have that's going to help you succeed on test day, because I know you have one. What's that one strength that you guys have that you're like, yes, this is what's going to help me be successful? Time management, being consistent, absolutely. Your faith, that's great. I love that. Absolutely. Staying focused, those are huge. This is what I want you to carry with you, not just into your exam, but into your practice as a nurse if I don't ever get to have you join me again in a lecture. Nursing has never been about knowing everything. It's about knowing what matters most. It's in the moment when it matters most. You will not walk into the exam or into your first shift feeling perfect. Guys, you're never going to know everything. I've been an educator for 5 years. If I took the NCLEX tomorrow, I would get some wrong. You don't have to be perfect. You want to focus on excellence. What you need is the ability to pause, think, and prioritize, and act in a way that's going to protect your clients. Because at the end of the day, your clients, they're not depending on your ability to recall every detail. They're depending on your ability to recognize, is there something wrong, and that you do something when there is something wrong. So as you move forward, shift your focus. Don't try to be perfect, but work to become consistently safe. From memorizing to understanding what truly matters. Because safe nurses, yeah, they're going to pass exams, but they're also going to ensure that our clients have the best outcomes possible. Now, if you are like, hey, I really want to practice what a 2026 NCLEX would look like, We have a mock NCLEX session. It is tomorrow. If you register for this session, it does cost $50. You get 85 questions. There's a link to it after you register, but you will get 85 questions, a test that you can take. When we meet tomorrow, we're going to be going through strategy. We're going to be going through the why behind every question. It's a 2-hour long session tomorrow. We've got about 44 people joining us as of now. We probably won't offer it again for several weeks, but if you are interested in that, I will leave that QR code up. Are there any last questions that I can answer? I want to make sure that I've answered that you feel like you're walking away with some more certainty. The other thing is, if you are unsure, you're like, I don't know what package is in alignment with 2026. Archers are, just to clarify, but if you're not sure what you need, you can always email us. It's just nursing@archerpulse.com. Nursing@archerpulse.com. That is the best way to ask our nursing team any questions that you might have over the next several weeks as this new test is preparing to launch. Someone said, I want an Archer subscription, but which one is best? I would recommend our SurePass package. And our SurePass package, the 90-day plan becomes with an exit exam. With an exit exam that you can take, and it will score you on your probability of passing your NCLEX. I would highly do the 90-day SurePass plan. It's the best value for the price, so that would be my recommendation. If you are a repeat test taker, Intense Prep would be the best recommendation for you. All right. If you guys need anything, I know we're a little over time. The status still has partial credit. Yep. Scoring is not changing. Yep. Scoring is not changing. Was this helpful to you all to go through this together? Did you find that there was benefit to talking through this? Okay. Yes, it looks like this brought some clarity. Don't let panic take over. I know it's very easy to let that happen, but something I do, how I know all of these changes, our team attends the NCSBN conference every September. And I personally, along with other team members, went line by line through every item of the NCLEX test plan and compared it to the 2023 version. So we know every single change that is happening, and we're making sure that that material is within our Archer content. So thank you guys so much for joining me today. I wish you each the best of luck. We're rooting for each and every one of you, and Archer's here for all your needs. But I hope you guys have an awesome Thursday, and we'll see you next time. Bye, guys.